Good morning and welcome to our COVID-19 Q&A session. My name's Ann Hutchison. I'm President and CEO of the Fort Collins Area Chamber, and we are thrilled to be able to offer this opportunity for you to get an update on all things COVID, as well as an opportunity to ask questions of various county staff members. We only have 30 minutes, so we're going to be short and sweet. We are recording today's call. You acknowledge that as you came into the room. We invite you to use the chat feature. It's a great place for you to share your questions or your comments. We do ask everyone to stay on mute unless you're invited to come off to share some thoughts and participate. Additionally, we are translating or interpreting today's session. I want to turn it over to Astrid to share some comments about how you can access that. Go ahead, Astrid.
Thank you very much. Good morning. My name is Astrid Arroyave. I am with Community Language Cooperative, and we are opening up spaces for language justice, which means that we can talk in the language of our hearts, the most comfortable to us. We are going to do this through simultaneous interpretation. Let's please remember that Spanish is 25% more extensive than English. So let's relax and talk at a comfortable pace. If I bring out my image and I make this sign, I'm asking you to please elongate what you're saying and slow down. And if I do this, I'm telling you that I cannot hear you well enough for interpreting. At the end of this short introduction in Spanish, you are going to see a globe icon in the bottom of your screen that says interpretation. Please select your channel there, English or Spanish. And if you are fully bilingual, feel free to just hear the full conference in both languages. You also have the option of muting the original audio, so you don't have to deal with two languages at the same time. And when you are not talking, please silence your mic. Hola, muy buenos días. Mi nombre es Astrid Arroyave. Estoy con la Cooperativa Comunitaria del Lenguaje, abriendo espacios para la justicia del lenguaje, o sea, el idioma de nuestro corazón, en el que nos sentimos más cómodos. Lo haremos a través de la interpretación simultánea. Recordemos que el español es 25% más extenso que el inglés, y aún en español, por favor, es un buen tiempo para relajarnos y hablar un poco más despacio, a un paso cómodo. Si traigo mi imagen y hago esta señal, les estoy pidiendo que alarguen lo que están diciendo y vayan más despacio. Y si hago esto, les estoy indicando que no puedo escuchar lo que están diciendo suficientemente bien para interpretar. Cuando termine esta pequeña introducción, en la parte de abajo de su pantalla verán el icono del globo terráqueo. Allí pueden elegir su canal, inglés o español, y si son completamente bilingües, pueden escuchar la conferencia en los dos idiomas. También tienen la opción de silenciar el audio original para que no tengan que escuchar dos idiomas al mismo tiempo. Y para finalizar, cuando no estén hablando, por favor silencien sus micrófonos. Y ya podemos prender la interpretación. We can turn on interpretation right now.
Thank you, Astrid. We appreciate you being here today and providing this interpretation for all of our audiences. Let me turn it over to Adam Crow. He's the Business Development Manager for Larimer County, and he will take care of our presentation from here. Welcome, Adam.
Thank you, Ann. And Ann, thank you so much for hosting this presentation and bringing us all together. This is an important conversation. And we do have several folks from the Larimer County Department of Health and Environment that are joining us today. We have Tom Gonzales, the Public Health Director. We have Jared Olson, Senior Population Epidemiologist. Matt Bauer, the Regional Epidemiologist. Chris Manley, Environmental Health Director. And our Medical Officer, Dr. Paul Mayer. And we're going to get started today with a presentation from Tom Gonzales, and then I believe he's going to pass it over to Gerald Olson to give us an update on what's happening with COVID-19 in Larimer County. But we also want to encourage you all at this time and moving forward to please put any questions that you want to make sure we answer today in the chat. So please, starting now, go ahead and feel free to drop those questions in the chat. All right. Well, Tom, if you're ready, we'll go ahead and pass it over to you.
Thank you, Adam, and thank you, Ann and Mindy, and everyone at the chambers. Appreciate that, and everyone on this Zoom meeting. I appreciate one. I just want to start off a heartfelt thank you to all our businesses, our activities, our places of worship throughout this pandemic. You made lots of sacrifices, and we know that. We appreciate that. You've saved lives. You have, and I know this is exhausting, and we're all fatigued. But we do believe there's a light at the end of the tunnel. All pandemics do end. Well, right now, what we're dealing with is Omicron variant has taken over. It is the dominant strain. And it's what's extraordinary is it's outcompeted the Delta variant in less than 3 weeks. All the sentinel testing from the state health department, from the labs, shows a 100% Omicron. So what does that mean? Omicron, as you are all seeing when you look at our data dashboard, is very, very contagious, maybe 5 times more than the Delta variant. But there's maybe a good side to this, is that it appears to show less symptoms, less severity to the individual. Still early on, but we are seeing less ICU hospitalizations. I just met with our 2 big hospital systems, UC Health and Banner. They're reporting that information to us. They are seeing a slight uptick in the med surge. That's a step down below the ICU, but these people are not as sick, which then keeps our ICU open, and they're not as compressed or overwhelmed as they were with the Delta variant back in November. So that is one good news. But what does that mean for our infrastructure here in Larimer County? Right now, we have concerns that there is going to be disruptions by just the sheer number of cases. We're already seeing disruptions with our in-person learning in our schools, which we've made a priority, as well as our essential services. So what we're asking all of our businesses to do is start planning ahead. What happens if you do have a reduced workforce, which you probably already have? What happens when you meet, what levels do you hit when being able to do your essential business functions? So that's really kind of where we're asking, put a plan together that's going to be individually planned, not a requirement, certainly a recommendation. And I want all our businesses to hear, I want to be very clear, we do not plan on placing any capacity restrictions on businesses in the coming weeks. We don't think it'll work. This Omicron's coming in so fast and furious that we believe it's going to be short-lived. We're going to have this incredible spike, which you're seeing, and we assume here in the next 3 to 4 weeks, it's going to come down. However, the next 3 to 4 weeks are going to be very challenging for us all, just based on the number of cases again. What can we do? We do believe better masking, more of the surgical masks, or the KN95 mask will protect your staff from being potentially exposed and getting sick and not being able to work. We are providing a limited number of surgical masks. Many of you have signed up. That's great. We're going to get those masks out as soon as possible to you. Corey with our team is on the call. If you have a question regarding masks, what type of masks, et cetera, and how can we get masks to you to protect your staff, your workforce, because that's key right now over the next couple of weeks. We strongly recommend boosters. Boosters are very effective with the Omicron variant. We have increased our vaccination capacities. We're now going to be offering more clinics, such as today at the Otsalon Center till 7 o'clock at night, for boosters and other doses as well, to get more shots in the arm to protect all of our workforce and people within Larimer County. Also, the short-lived, as we believed, ventilation. I know it's cold outside lately, but if you can increase airflow, ventilation for your workers so they have a less chance of getting those respiratory droplets and getting them sick, that's a recommendation. Right now, we're still doing our best we can to protect the most vulnerable, those that are unvaccinated and those that have immune compromise. Those are the ones we're seeing in the hospital. Our hospital, UC Health, is reporting 82% of the hospitalizations within the last week have been unvaccinated. So we're still encouraging those that are able to get vaccinated as soon as possible. We are hearing testing lines are difficult because of the demand. We're working with our provider, Mako Health, at our 3 locations in Fort Collins, Loveland, and Estes Park to increase testing as much as possible. We're also working with our state partners to see if we can get more at-home testing kits. Those are flying off the shelf as quick as they're being put on at the drugstore. So those are some things we're working on as well. I want to make sure we're being quick, so we can get to Q&A, but I am going to turn it over to Dr. Jared Olson to just give a brief update on our metrics, and then we'll get to Q&A. We want to hear the questions from everyone. Jared?
Great, thank you, Tom. I'm going to go ahead and share my screen here. Okay, so much of what we're dealing with here is also happening across the state in multiple counties. We have a challenge with testing resources and availability, so we know we're not capturing all of our cases, and it's just spreading so rapidly that not everyone is also seeking testing. So our positivity rate is the highest it's really ever been. We've had a few days that were like this when we had low testing availability in early 2020, when the pandemic was started. But with this type of testing availability, that's a very high number. So we know we're catching only a small proportion of cases. Case rate is the highest it's ever been and continuing to grow rapidly, though you may see some recent days that are lower than they will ultimately be because the state level system is being overwhelmed with cases as well. So that's on the case side. As Tom mentioned about the severity, we know there's from other locations across the world where we've seen an Omicron wave, there is less severity. It's still causing some people to have severe cases and be hospitalized, but it is lessened. The sheer size of the wave is likely to overwhelm that severity advantage and to increase our hospitalizations and our ICU potentially as well. So we do expect these numbers to continue to increase as this wave increases, though we are hopeful based on what we've seen in other countries that we will see it pretty rapidly decline once it does hit that peak. But we are pretty optimistic that it will rapidly decline once it hits that peak. So that's what we're looking at right now. And with that, I'll hand it back to Tom.
Thank you, Jared. I appreciate that. Adam, let's open it up for the Q&A.
Because the timing is good. We have some questions that are coming into the chat. So the first one is from Christy, and she's talking about the Azalon Center boosters for 12 plus, having trouble finding places to do boosters for newly approved age groups. And then she has another question about masks, but maybe you could talk a little bit about boosters. Who's approved right now? What's on the horizon? Places that those can be gotten.
Corey, I know you've been involved with that. Would you jump in on that one?
Yeah, the CDC this week did recommend that 12 and up, so the 12 to 15-year-olds are newly eligible now to get a booster. It takes a little while for our systems and for other provider systems to get updated to be able to register new groups as they open. We do have a limited number of slots for our 12 to 15-year-olds at the Azalon Center. Until 7 o'clock today. I think they open at 1. And so limited spots, can't guarantee it over there, but you can just walk in today if you have a 12 to 15-year-old kiddo that you've been trying to get in. Like Tom said, we have doubled our capacity. And so if you can't get in today, there will be plenty of availability next week and going forward through that Azalon clinic, through our Fort Collins regular clinics at the health department. And then also in Loveland, we have an extra 400-ish slots per week now opening up. So yeah, you should be able to get that in short order. Our online system should be ready to go today with registration. So just check back on that a little bit later.
And Corey, do you have a web page that folks can check back to?
Sure. Yeah, I can put it in the chat. It's larimer.org/COVID vaccine. Also, if you noticed at the top of the larimer.org website, at the very top, there's a banner and you can click on data, testing, vaccine, and business guidance. And so that's kind of an easy way to find this stuff as well.
For sure. And Christy is also saying she's excited about the availability of masks, but there's also within her comment a concern regarding, well, who knew we'd have counterfeit N95 masks at one point, but apparently we do. So any way to tell, any concerns around that you all are aware of?
Yeah, Matt Bauer, are you on? I know Matt, our regional epidemiologist, has been looking into this, and we've been hearing this issue.
Hey, sorry about that. Yeah, so as far as the KN95s go, yeah, we are seeing CDC put out some information recently that about 60% of KN95s that you buy on the market are either counterfeit or they're not up to grade based on the US standards. So kind of what we're doing and what we've seen in past is, there are so there's procedure mask and there's surgical masks. Surgical masks are graded with different levels as well. And so what we're really we'll be pushing out and recommending is literature and research has found that if you combine a high grade surgical mask with a cloth mask over it and make sure that that has a good fit, it really does perform really well. And so that's kind of going to be the main thing that we're going to be recommending to folks. We are looking at as well, we do have some supply of what we call particulate N95s. These are used in a lot of industrial settings. So there's particulate N95s and the medical grade N95s. But for the particulate ones, especially in settings where people are working, within 6 feet, that, like in manufacturing, if they're working with vulnerable population and those sort of things, we are going to be looking at, we do have a supply of those as well that we'll be distributing on a case-by-case basis. But yeah, so unfortunately with the KN95s, just with what we're seeing, we would rather, provide masks that we feel confident are going to be legitimate, provide a high degree of protection rather than, masks that we're not really sure of. And just to kind of go further on that point, as far as KN95s go, our medical distributors don't even deal with those. So those are only purchased through Amazon and other unknown sources. And oftentimes with those, they're in limited supply. So you have to purchase small quantities and it increases the per unit cost as well. So all of those reasons is kind of why we are straying away from the KN95s and instead using some of the surgical mask and the particulate N95s, and then we'll be distributing those based on, the settings and level of risk for employees.
Great. Thank you for that update, Matt. And then, so on that end, in trying to help people access those high grade surgical or medical masks, Corey, it sounds like you're doing some work on that. If there's a link that you could put in the chat, that would be excellent around how folks can order those. Thanks so much. So the next couple of questions are around testing. So how can we get tested for new variants is one question, and then that goes into the next question, which is, getting the Bionex Now test kits for our staff so they can do some of that at home. Any thoughts on how tests can be how you can get tested right now and what's the best way to do that? And then if you do need those at-home kits, are there any resources available right now to access those?
Jared, would you go over how the state looks for the variants?
Yeah, so unfortunately, there is not an individual level way to know if your particular case at this point is the Omicron variant. However, all of the sentinel surveillance, so a proportion of cases that are assessed through PCR testing are sent to the state, and they are screened and the whole genome is sequenced to identify the variant. 100% of those that came in thus far from this prior week were the Omicron variant, and the week before it was in the low 90s. So almost assuredly, everybody who is going to be a case, almost everybody, if not everybody, will be the Omicron variant at this point. We do have other opportunities to monitor for future variants, and it's one of the ways we first identified Omicron in Larimer County as well as in the state, which was wastewater surveillance, as well as the sentinel surveillance that we use. So rest assured, we continue to look for variants, but the overwhelming chances are if you become a case from now on, it will be Omicron until something else changes.
Wow, that's eye-opening. Thank you, Sharon, for sharing that. So the next question, Lisa had seen something in the news that there's no longer quarantine time that's required. Is that correct?
No, it's not total. Matt, if you want to jump in, where we're struggling is we had 600 cases on Wednesday in the same conversation we're having with our school superintendents. We can't really quarantine. So Matt, we're prioritizing high risk and in-person learning and essential services. But we're going to ask people to self-quarantine if they believe they were close contact to a case. And Matt, could you go over that a little bit further?
Sure. Yeah, so as far as quarantine goes, there have been a lot of clarifications from the CDC, and we're still learning more. So as far as looking at quarantining, really the isolation right now is saying, you need to isolate for the first 5 days and wear a well-formed fitting mask from day 6 to 10. And so in settings, if you're exposed, during those first, days 1 through 5, we will be quarantining following the CDC guidance to quarantine for the first 5 days. We are recommending testing after that, but if you remain asymptomatic, then you can be released. As far as, if people are exposed through day 6 to 10 to someone that is consistently and 100% of the time wearing a mask, then we would not be quarantining during those times. So it's going to be really challenging. But so for instance, if someone in a household is positive, they're wearing a mask at all times within the house, they're not eating with anyone, pretty much they're never at a point, around those people from day 6 to 10 unmasked, then, we're not considering that point of time to be an exposure. Obviously, really in those settings, really recommending if you're infectious, stay in a separate room at all times, eat in that room and stay away from the family. So I hope that answers your question.
Thank you, Matt. So another question, and this is around the boosters, and Cami has posted this. So how have you determined that the booster is effective against Omicron?
Jared or Dr. Mayer?
Yeah, we have data already from other locations, including South Africa and the UK, where Omicron waves have occurred first. And we do see additional efficacy or benefit from the booster, not only in reducing hospitalizations, which it does, but also in reducing symptomatic infections and in increasing the levels of neutralizing antibodies, basically your body's first wave of defense against viral infection. So those you can increase 30, 40, 50 fold with a booster shot and kind of reinvigorate them. And those are pretty effective against Omicron. So the best defenses against Omicron are either 2 doses of vaccine and a prior infection or 3 doses of a mRNA vaccine.
I'll add one thing just briefly that CDC revealed just recently on their call is some good news is that the boosters do seem to work almost immediately. The antibody response is remarkably quick. And so usually we would say that 2 weeks after your shot is when you got the full protection, but with boosters, that's not true. They're considering you to be boosted really within a day of your shot, that antibody response is really robust, which is excellent.
Well, that's good news. Yeah, thank you both for sharing that. So we've got several questions and just a little bit of time left. So Corey is going to start answering questions in the chat. So please pay attention to see if your question is being answered in the chat as well. And then also, Corey, while you're at it, if you could post the contact information for the Joint Information Center. These are the folks that are working overtime at the health department right now to answer questions. So if we don't get to your question today, know that there is that other opportunity, and we encourage you to reach out to the folks at the Joint Information Center. So the next one we have here, Jose Luis is asking if there are enough masks in this stockpile that the county has to help us get through the next 3 to 4 weeks.
Corey?
You asked the question again. I was writing.
Oh yeah, sorry, Corey. We're giving you double, triple duty right now. Do we have enough masks that in the stockpile that you're helping to distribute to get us through the next 3 to 4 weeks?
We do have masks, a good quantity of masks available right now. So we'll go in the order of requests received, and then we're getting another large shipment in next week. And so we're just going through now all of those requests and determining how many we can offer. We will give some instructions out that some of the masks can be reused until they're, wet or soiled. So we'll give out some information around that. But we should have enough here. We're hoping this is a quick wave and that this is kind of a short-lived thing and we can get out as many as we can.
Great. Thank you, Corey.
For sure.
All right, thank you. So Deb at the cooking studio does have a question, and we may have touched on this one a little bit, so maybe just a quick clarification. Are the rapid tests valid for Omicron? If not, what rapid testing should we be using?
Dr. Mayer?
Jared may want to weigh in on this as well, but yeah, the rapid tests are still useful against Omicron, but they appear to be less sensitive. I haven't heard an actual number on that for like a Binax now. Jared may know an actual number, but so they are valid, but they are less sensitive at picking up Omicron, unfortunately.
Yes. So a PCR test is going to identify a case as the gold standard almost all of the time, early, middle, late. A rapid test should not be significantly compromised by the mutations to this particular virus. They're identifying different parts of the virus. However, there is something seemingly about how quickly the virus replicates in your throat and where you're sampling from. So there does appear to be maybe a day of potential infectiousness at the front end where you may not be positive on the rapid test, but then subsequently you would be both infectious and registering positive on the rapid test. So I would not, if you know you have a known exposure and you get a negative on a rapid test 2 days later, I would not say that tells you you did not get COVID. But I would say that if you are using it as a serial testing option, or you're testing without symptoms or just on a regular basis, that's a pretty good risk reduction strategy. If you want to know definitively whether or not you have COVID, then the best test is a PCR. But if you want to know as quickly as possible and with relatively good certainty, not absolute, but relatively good, then a rapid test is still a very useful tool.
Great. Thank you, Jared. And this next question may be for you too while you've got the floor. Any information on the percentage of positive cases that are folks who are vaccinated versus unvaccinated?
Yes. So because this variant is so immune evasive, folks who may have been less likely to get Delta or Alpha or prior variants because they had either a prior infection or because they were vaccinated are now more at risk of getting a symptomatic infection with this. So we've seen, it used to be a 3.5 or 4 times higher case rate for unvaccinated folks compared to vaccinated folks. Now that's closed that gap. It's about 1.5 times. So the increase in the likelihood of becoming a case has jumped for vaccinated individuals, but we're still seeing among hospitalizations a very, very significant gap between those who are unvaccinated and vaccinated. So the state data is reflecting this. Omicron in New York State, where we're seeing a big wave, is also reflecting this. And even in our local ICU system at UC Health, 82% of the ICU patients are still unvaccinated. So we've seen a little reduction in the efficacy, especially of just 2 doses of the mRNA vaccine for protection. But ultimately, those who are unvaccinated and those who have prior infection but no vaccination are the most vulnerable for severe disease.
Okay, so knowing that the boosters make a big difference, it sounds like with Omicron as well, is it still a 5-month recommendation after you've gotten your last dose before you get boosted, or is that time frame shortening due to Omicron?
I believe so. Recently was moved from 6 months to 5 months. And I believe there's an exception for immunocompromised individuals, potentially, Dr. Mayer. I'm not sure if that's the case.
I did put the booster eligibility into the chat.
So yeah, for Pfizer, it's 5 months. I believe Moderna is still 6, and remember J&J is 2 months. And I, you know, things change so fast, but at this point, I don't know of an exception for that booster interval for immunocompromised. Although remember, they are supposed to have gotten a third or additional dose with their primary series for the immunocompromised folks.
Great. Well, we've hit the end of our time, and we certainly didn't get through all the questions. So we hopefully Corey was able to answer many of them. And if you didn't get your question answered, please contact the Joint Information Center. The folks at the health department there are ready to answer your questions. And Anne, thank you so much for hosting again. We'll turn it on over to you.
Fantastic. Thank you so much for emceeing for us today. Adam, thank you all for joining us. And thank you to the health department for being available and willing to answer the questions. We encourage all of you to continue to stay safe, do the things that you can in order to be a part of the solution. And we look forward to hopefully not having to have very many more of these conversations. Have a great day, and thanks for joining us.
Great. Thank you, everyone. Take care.